Thank you for staying with us on Channels Television. Welcome to Health Matters. I am Yomi Otaibe. In 2020, that's last year, COVID-19 dislodged tuberculosis from being the top infectious disease owing to its mortality rate, and that's according to the World Health Organization. However, tuberculosis remains a major disease of public health concern. In 2019, an estimated 10 million people worldwide developed active tuberculosis with 1.4 million TB deaths. The World Health Organization's region of Southeast Asia, Africa, of course, that's where Nigeria is, and the Western Pacific have been identified as having the most TB cases. How can tuberculosis be prevented? How is it transmitted? And what is it that is the burden in Nigeria in terms of the concern for public health? We have in the studio, joining me now, a public health physician, Dr. Jamiu Ganiyu. Thank you so much for being here.
Thank you very much.
Good to see you, Doctor.
Good to see you too.
Okay, so we're talking about tuberculosis, and as a public health physician, I know you go into the community. Paint a picture, for us, what the situation might be. I know in Nigeria, we hardly can lay our hands on, specific statistics as to what it is, but let's have, your thinking on this.
Okay, thank you very much. Not really that we don't have statistics, we have.
Yes, we do have. I'm just saying, that's one that you can say.
Okay, let me just say, as part of my introduction, tuberculosis is an infectious disease condition which primarily affects the lungs, usually in 15 to 30% of cases. Not only the lungs, it can also affect other parts like the brain, the joints, bone, and many other places, and that is what we call the extrapulmonary tuberculosis. In Nigeria,
the brain, the joints?
The joints can even affect the abdomen. We have what's called TB abdomen, and it can affect the lymph nodes. So depending, but generally what we are talking in particular now is the pulmonary TB. Really why it's becoming a disease of concern is the fact that the detection rate is still relatively low in the country, and the level of awareness is not too encouraging. And also, in terms of treatment coverage, we are still relatively behind, around 31% in the country. Before now, in terms of case detection rates, using the current technology, we call it gene experts, the uptake, that has been relatively low, not of recent one, we now have relatively around 60-something%. So actually it's a real concern to us in the sense that there are a lot of them living with us in the community. And why is it so? Another major concern is that majority, when they go to a facility to assess care, they wear the handkerchief, whatever. But the moment they leave, they don't conform with infection control. They mix with us in the community, in our homes, and so on, thereby exposing individuals to the risk. And it has been, studied that a person with a case of TB, active TB, has a tendency of spreading it to about 10 to 20 persons in a year, which is an issue. And we, apart from that, in the country, we are signatory to the WHO commitment to ending TB by 2035. And we need to, for us to achieve that, there are a lot of things that need to be put in place. And really, the country is trying, but we still need to do more. That is for now. That is
let me take you back on what you talked about, level of awareness. I'm sure, okay, so I may not have that specific statistics as to how many Nigerians will know about TB, but at some point in time, whether at the health facility, because we'll still come to the issue of vaccination, because we have vaccination for TB, the parents would have heard that there's something like this. Someone would have said there's tuberculosis. So why do you think that the level of awareness is low?
Well, it's still low in the sense that people just assume that anybody that cough may be anything. they may not think that somebody is having TB. What I mean, the levels of awareness is low is that you don't expect somebody that is having active TB to...
And that is aware
of it, and they will still be sleeping with people in their homes, mixing up with children, with the elderly, and so on. They mingle with people in the public transport and so on, that by spreading it, you know.
Now, we'll come back to the issue of stigma.
Yes.
Perhaps stigma may be driving, you know, this kind of reaction for people who have the disease and don't want someone else to know, because they feel once you know that this person has TB, then it becomes an issue. Yeah. Now, let's talk about the transmission of TB itself. Okay. It's a bacterial
infection.
Yes.
Actually, it can be transmitted through inhalation of contaminated air with the bacteria. That is when people get infected when they inhale it, especially if there are people that are within that vicinity that have active TB. And they can get it through either when that person cough, sneeze, or while talking. So that person can get that. And another thing that can encourage that is when people that are living in a very maybe close, maybe in a confined place, in an overcrowding situation. So people like that too can also help in doing, in spreading.
So if somebody with active TB coughs, it can stay in the air for how long for another person to be able to pick it up?
Well, there are different, I don't want to be specific right to that, but it can take, I don't want to give some, say, for some 24 hours, some, depending on study, but I don't want to be very specific, but it can still inhale for some time for an individual to, a susceptible person to inhale it. So that is why...
a susceptible person. What makes one susceptible? Susceptible,
for instance, somebody, a minority, somebody like in children. Children are at risk of TB. That's if there is an active TB person in a home, children are more likely to be infected. Likewise, it has been attributed to be a disease of poverty, and also overcrowding is another. Smoking. Even people that consume alcohol, given an estimate about 40 grams per day, are more likely to be at risk of...
let's take it one by one.
Then diabetes.
Overcrowding.
Yes.
So, of course, that would suppose that the air is just, that everybody's breathing is almost the same. And perhaps there's not proper ventilation too.
Yeah, exactly.
But you mentioned smoking.
Yes.
Okay, smoking has to do with the lungs, yes. Yeah. But because a person smokes, is susceptible to having TB.
Yes. Because, it has been attributed because, smoking cause more than 1,000 diseases. That is why, smoking, it can destroy the lung architecture, that by giving opportunity for all sorts of kind of infection, like TB it has been. And there have been a lot of studies that actually, link smoking with TB. So there are a lot of studies in regards to that.
HIV too?
HIV is one of the drivers. It has been found because TB has been associated to be linked with a level of immunosuppression. That is why HIV is one of the drivers. And apart from that, people that are...
So somebody whose immune system is suppressed?
Yeah, exactly. Like people that are on immunosuppressants, like people that are taking steroids, cancer patients, and so on. People with kidney diseases, so they've been found to be at risk of...
So they would need to take extra care.
Exactly. And people with diabetes. Diabetes have been also associated with a kind of decreased immunity.
So they have to be circumspect in the kind of environment
exactly. So those are some of the people that are likely to be susceptible to get infected from an active TB patient.
You mentioned earlier that, yes, one of the symptoms of TB, if we can talk about that, is cough.
Persistent cough. Okay. Maybe somebody coughing more than 2 weeks. At times, the sputum, the sputum may be stained with blood. They could have fever, drenching night sweat. They sweat most of the time at night. They could have, later on, they could have difficulty in breathing. They could also have chest pain, and they could have pure hemoptysis, that be coughing out blood. So that is for pulmonary TB. But for other type, the extrapulmonary, they can present with symptoms suggestive of the the organ that is being affected. So that is the classical presentation.
Okay, so if it's not pulmonary TB, if it's pulmonary TB, it will be coughing. That will be perhaps the main kind of symptom.
Yes.
But for others, there may be no symptom that one can see or one can think and say, okay, because this person is coughing, I need to, step back.
Yeah.
But for those other ones, how do you now protect yourself?
Like, well, that could be linked. But most of the time, like, let me just give an example. People that develop TB of the spine, they can just present with paraplegia. That is inability to walk. Then people with TB meningitis, common in children, they could present with convulsion, eventually coma. So depending on, and again, they could, TB of lymph node, they could have swelling in the body. But usually, most of the time, is by proper diagnosis, early and proper diagnosis, that can let us we establish whether we are dealing with what kind of TB or the other. That people with that will require more further investigation apart from the sputum, a CT scan, MRI, ultrasound and so on. So for us to, even histology, taking sample may also be encouraged in such situation to be able to diagnose such kind of person.
How long does it take for TB to start manifesting?
Well,
from infection?
Well, it could take like, depending, it could take three months. It could be 3 months, 2 months, 3 months, and more, depending on the level of immunity and so on. But one thing I want to say particularly again is that in HIV patients, they may not present with that classical symptom. They may be harboring. Then I want to clear one point again. In TB, we have what you call active TB, and we have what you call latent TB. Active TB, globally, about 25% of people are infected with TB, of which only 5 to 15% actually end up having active. Active means they're harboring the bacteria and they develop clinical symptoms. But for the latent, they're harboring, but they are not showing any sign of symptom. So those people cannot actually.
At that point, can they transmit?
No. They can't. They can't do that. So we have people like that. Yeah.
Okay, so perhaps their immunity is trying to deals with it and it's not letting it progress to
exactly,
disease
because
condition.
Just like what I just told you now, it's only when somebody is coughing, sneezing, actually spreading the virus in air that somebody can actually get, infected with it. So when people have it later and they're not showing any clinical symptoms, the tendency of them actually transmitting such kind of infection is limited. They're not showing clinical symptoms.
Let's talk about prevention, and I'm sure you know that vaccination is part of it. Let's talk about this because that's very key.
Actually, before we talk about, in terms of trying to control TB, go beyond just prevention. Because if you don't take care of those people that are infected, they will continue to serve as a reservoir of spreading it. So we need to talk about
their treatment.
Yes, prompt diagnosis is very important. And apart from prompt diagnosis, we need to also carry out contact tracing. The moment somebody is diagnosed, you need to do contact tracing of people that are living with that person. And apart from that, doing contact tracing, there are some key population too that who are also drivers of TB.
We'll come back from this break and we'll talk more about the treatment and, of course, prevention of tuberculosis. Just stay with us on Health. Thank you for staying with us. It's Health Matters on Channels Television, and we're talking about treating and preventing tuberculosis. You can join us in the conversation by calling 080-546-83514. The number would be on your screen. Before we went on that break, we're trying to talk about the importance of treating tuberculosis. Yes. Let's talk more about this. How long does it take, to treat from the diagnosis to treatment?
Usually, it depends on the type. As I've said, we have pulmonary and we have extrapulmonary. The minimum for the pulmonary is 6 months. Then for extrapulmonary, it may take 12 months. Then we have another new dimension to the infection. That is those people that have developed resistance to the normal anti-TB, the first line. So
because
those people,
there's the multi-drug resistance
that's what I'm trying to say. Those one will take 18 months to like 2 years. So that it depends on what we are dealing with. But the most important is to take care of the reservoir. Those people that are actually shedding the virus. By the time there must be prompt diagnosis, treatment. Then also I made mention of vulnerable groups. those people must be on prophylaxis. We'll be able to identify people like the HIV people are usually on.
Oh, okay, sorry, doctor. Just hold your thoughts, please. We have Okora for joining us from Abia State. Thank you for joining us.
Good afternoon, my sister. Good afternoon, Dr. Ganiyu.
Thank you. Good afternoon.
Doctor, I want to find out from you. Somebody suffering from TB. Do the person have a special food? Sometimes people will say that they don't eat fried food. And based on what you have been analyzing, can one contact TB through kissing?
Okay, thank you, Okora, for your question.
All right. Thank you very much.
Okay, thank you very much. We encourage people that, I made mention of malnutrition. So usually people that is one of the risk factors. Well, usually we encourage them to eat very well, because one of the major reasons why some of them don't even want to comply with the drugs is when they've not eaten. So we encourage them to eat healthy. Usually it's only on TB they should have healthy diet. They should eat well. Then as regards to, for the fact that somebody is coughing, we say somebody can get infected from coughing, sneezing and so on. Possibly by kissing, somebody can get
someone that has active TB.
Exactly, because if the saliva is already contained in microbacilli, somebody can the acid bacilli, so somebody can get infected through kissing. Yes.
Okay. Yeah. Quickly, we're talking about the treatment.
Yes. So as I've said, 6 months. That is for the normal pulmonary TB without any complication. Because at times some may, finish the 6 months, relapse, or had treatment failure and they need to start all over again. As for the pulmonary, extra pulmonary, 12 months. Therefore, these who have multi-drug resistance, they may take 18 to 24 months. So those are that is the difference.
If there is a break in the treatment, can it affect, the outcome of that treatment?
That is the problem we're having now. The issue of defaulters. And that has contributed to the multi-drug resistant TB we are talking about. Because this drug required to be taken for that complete 6 months without any breakage. And many people are not defaulting. They are not, issue of adherence. I agree with you, pill burden and so on. But ideally, if people do not conform with treatments, they end up developing resistance, which is one of the commonest things. Then apart from that, instead of people to patronize a recognized, well-trained, well-skilled health facility, people out of stigma that you mentioned earlier, they patronize quacks, patent medicine store, farmers who have no knowledge of such condition. At the end of them, they are being given either poor quality drugs, or they are being given lower dosage, because there is a standard dosage for dosages are calculated based on weight. Then some people are being given dosages that are less than the normal duration of the cost for that treatment. And that's why we're having issue of multi-drug resistance and so on. So those are some of the things.
Okay, yeah. Doctor, we have your namesake on the line, Jamiu from Lagos.
Okay. Yeah, good afternoon.
Thank you for joining us.
Yeah, good afternoon. I want to talk to Doctor. I'm watching the program live now. I just want to ask a question. If somebody has been contacted with that TB and it has been treated, does he has any effect again with other relatives?
Okay, so if the person, I'm assuming that if the person has completed the treatment,
yes,
is asking, can the person still transmit to?
No. One thing is that when somebody is satisfied to be cured, especially for the classical, that is the 6-month course, if somebody can be satisfied to be cured, that person cannot transmit. It is expected, in the 6-month course, that what you call the intensive phase and the continuation phase. The intensive phase is for the first 2 months. It's expected that at the end of the first 2 months, somebody will have done what we call that is sputum conversion. That is, the sputum will no longer contain the microbacilli, maybe the bacteria. So at that point, and that is why in the treatment approach, we do what we call, that's what we call, you'll be hearing about DOS center, right? They call it directly observed treatment short course. Ideally, during the first 2 months.
Where can we find these DOT centers?
We have them in our primary care centers. Most of our secondary facilities and teaching hospitals are there. We have their focal person. And they liaise with the TB state program officers. They are well coordinated. But the point I'm trying to say is that it is expected that if somebody have an effective treatment, after 12 months, the sputum should not contain the bacilli. But if it continue, will continue until at 6 months. Before somebody can be say he or she has been cured, they will have taken the sputum and they'll carry what you call sputum microscopy to be sure that that person is free. And that is when that person is declared cured. So in case there is any complication or that person is still, shedding that bacteria in their lungs, they will have to do a kind of repeat treatment.
Let's quickly go to prevention.
Yes.
So I'm going to take it in 2 parts.
Yes.
For those who have the disease now and are treating it,
yes,
what should they do so that they don't, transmit or shed it in the general population? And what should people who think they don't have, because you really need to have checked yourself, but particularly if you have cough, as you've said, to know what is the prevention will be like?
In prevention, we look at it at different levels: primordial, primary, secondary, and tertiary. Primordial, that will be proper legislation, good policies, stewardship, accountability.
What policies are you looking at?
Policies that will ensure that we have more resources, policies that will help in encourage a kind of notification, because we're having issue now with some people are bringing, but they can the kind of case detection has been an issue. Then enabling policies so that there will be different players. Government cannot do it alone. We need a kind of civil society coalition.
Okay.
So we need to have that.
Let's have Isaac join us.
Okay.
Hello, Isaac.
Good afternoon.
Thank you for joining us.
Yeah, please, can I speak to the doctor?
Go ahead, please.
Doctor, please, I want to find out from you about all what you said. I'm a patient of TB. I've been treated several times. And I have cured everything, just did everything. The 6 months, I took my drugs, I completed it. And 9 months, they said I completed it the second time. But my question is that does causes the swelling of leg and face in my body, does TB causes swelling of leg? Because for now, I'm not having TB, but my legs are swollen up.
Okay. Thank you, Isaac. Thank you. Thank you. I think Isaac's case might need
we need a proper evaluation, because it may not be TB, and actually TB can cause, as I said, lymph nodes. It can affect the lymph node and cause swollen neck. But based on what he's saying, having leg swelling and so on, I think you need to go for proper evaluation to be sure of what is actually happening. It may not be the TB, and it could be.
Okay, so in winding this down,
then
we're talking about prevention.
Yes.
So coughing in public should be avoided. And we're talking about COVID-19 and asking people to use their masks.
Which is helpful a lot. It has really helped a lot, because before now, people that have harboring infection, that have active TB, most of them...
But most people are still not using the mask in public places.
I agree with you, but relatively with the COVID-19 pandemic, I think wearing of face masks has improved relatively compared to before, where people that are having active TB are mingling with people within the society. So I think the COVID has even helped out making sure that people wear their masks.
Cough hygiene.
Cough etiquette. Then, as I've said earlier, there are some vulnerable people who are supposed to be on prophylaxis, like, as I mentioned, TB. I don't want to mention the drug so that people not go and buy it.
No, don't mention
so
drugs.
We have the vulnerable people that are supposed to be on certain drugs to prevent, especially if there is a possibility of them being around with, the high chance of them getting the virus.
And for everyone who's had a persistent cough, you need to check it out.
They need to check, visit the nearby health centers where they can evaluate, because there are stages, presumptive, from there, based on the sign and symptoms I mentioned. Then from there, they can then be referred to go and do the appropriate diagnosis for appropriate diagnosis and treatment.
Thank you so much, Doctor. Thank you for coming on the show today. We've been having a chat on prevention and treatment of tuberculosis. Dr. Jamiu Ganil is a public health physician. Thank you.
Thank you very much.
And thank you all for watching. That's the show for today. We'll see you next time.